Can a fart kill a person? Maybe the people around you if it smells really bad. Cutting things off midstream, what in the world is Cuvade syndrome? And the age-old question, can farts kill you? What? Today we're back at it answering some of the most jaw-dropping medical questions from Discord. Brace yourselves, this may get a little out there. All right, let's dive right in. Hello, Dr. Wagner. I'm worried that I'm often aggressive. Tell me, is it worth worrying that I'm developing psychopathy? I am almost 18. When somebody's still a teenager, you're growing, you're maturing, you're developing your emotions, your hormones are affecting your emotions. So it could be quite normal to have some moments. Now, if it is there more frequently than any other emotion, then you definitely want to talk to somebody about it. Psychopathy is a neuropsychiatric disorder that is characterized by a deficiency in your emotional responses. So this disorder is marked by lack of empathy, aggressive behavior. If you are concerned that this is happening to you, definitely address it with a healthcare provider as well as maybe a psychiatrist. When you get a vasectomy, can you still get an erection naturally? And after you masturbate, do you just ejaculate semen or nothing at all? A vasectomy is when a urologist, a surgeon for that area, cuts the tube that basically supplies the sperm to your semen. Simple procedure, typically done as an outpatient. There is some discomfort. It feels like somebody gets kicked in the... You still ejaculate semen, it just is void of sperm. Hopefully, that's the point of this. It shouldn't change your sexual drive. It shouldn't change how you feel with an erection or arousal. Just to be aware, typically you still want to use some sort of birth control for the next 8 to 12 weeks after, just because sometimes the sperm sneak their way out. If we hold and stop semen in middle, where will it go? It will go back to prostate, or will it go into balls? I would not advise if somebody is trying to ejaculate and stopping in the middle and holding it specifically and preventing it from actually coming out. If you do actually have the contractions basically to where your body is ejaculating, it will make its way out if you don't allow it out, meaning it'll just kind of drip out or you'll urinate it out on the next time you go to the bathroom. There's something called a nocturnal emission to where the body's actually helping get rid of the older sperm that are in the body and allow it to get out. Is this a condition or something? I can burp controllably and I really have bad indigestion. Is this because of what I eat or something else? Could be something you're eating or it could be something that you might be intolerant to. GERD basically is when your stomach acids kind of flow up from your stomach into your esophagus, allowing back and forth. People complain of like an acidy feeling in their throat or feel like you can't breathe. Could be related to different intolerances such as gluten intolerance, lactose intolerance. Sometimes people can have what's called a hiatal hernia, where the top of your stomach is actually into the chest cavity through the diaphragm, and so it doesn't allow the top sphincter of your stomach to close all the time, so there's a little bit of an opening. What does it mean if hair in the armpits fall off? Could be related to skin conditions such as keratosis pilaris or seborrhea dermatitis. Also could be related to psoriasis. Different skin disorders could affect the way that the body holds on to the hairs and the hair follicles. Could be related to a low testosterone. Nutrition wise, macro and micronutrients could also play a part. If you do notice these things, just get your levels checked. Hey doctor, what would happen if you eat your own puke?
I just threw up in my mouth a little bit.
I highly do not recommend this at all. So your vomitus that comes out got acid in it. It burns your throat as it comes out. Your esophagus, tongue, and your mouth are not made to experience this much acid. It can break down the cells, can cause scarring. When people vomit and then try to eat the vomit, you always worry about aspiration, meaning you inhale some of the vomitus into your lungs, which increases the risk of pneumonia. Please don't do that. What situation would it be possible to have a bullet in your eye and still be breathing? I've seen a lot of bullet injuries where people survive and have a good normal life. It just all depends on where the bullet hits, how it hits. It is very plausible to injure your eyeball with a bullet, but without affecting your breathing apparatus and potentially dying. But if it just hits your eye, maybe the eye gets ruptured and you can't fix it. It could be lodged next to your eye in the orbital cavity. Be painful, but you may actually still be able to see. But typically, if a bullet goes into somebody's eye, you're going to have visual issues. You may lose that eye. But in this hypothetical situation, you can still live if your eyeball gets injured by a bullet. My brother told me when his girlfriend was pregnant, he'd get morning sickness as well. Is this really possible? And if so, then how so? It's a super rare syndrome called Couvade syndrome, and basically where the partner of a pregnant individual has these mimicking type symptoms of pregnancy. Not uncommon for individuals to have similar symptoms. I see so many people come into the emergency department, nausea, vomiting, constipation, not wanting to eat, bloated, weight gain, and a lot of times it's just related to the gastrointestinal tract. During pregnancy, the male hormones, or your counterpart in general, will actually fluctuate and change more than if they weren't around somebody who was pregnant. Why sometimes when you sneeze hard, you fart stingy, painful, small farts? Okay. It's actually related to your intra-abdominal pressure. So when you actually sneeze, super hard contraction, you force it out or you stifle it. Either way, I say let it out as long as there's space to do that. And it's these little squeezed out type farts because you're still having some contraction to your sphincter, your butthole, so it kind of squeaks out when it's super hard. Different motions and different activities can cause people to pass wind. Question: what happens when someone swallows a battery?
My body's rejecting it.
You should go get checked out because batteries are caustic. They can cause injury to the lining anywhere between your mouth to your anus, and it can cause erosions, it can cause perforations, and it's quite dangerous. The most dangerous batteries out there are actually those button batteries, which are the very small ones, because they can actually perforate the stomach and the intestines a lot more frequently and easily. If somebody actually does swallow a button battery, it's an emergency, and we typically will have a gastroenterologist do an upper endoscopy to actually get the battery out. So please try your best not to swallow a battery. This sounds like a stupid question, but why do my bones click and snap a bit as I wake up? It's most likely the nitrogen gas buildup within our joints as our joints are getting ready to be active and lubricated and move. If you've had an old injury, this could also occur. There's a whole specialty, chiropractic care, where people get cracked, so to speak. That's just the audible noise that you're actually hearing. If there's pain involved in this, definitely discuss this with your healthcare provider, your chiropractor, and definitely get checked out, please. Can a fart kill a person? Maybe the people around you if it smells really bad. Could a fart kill an individual who is farting? Unlikely. If the fart isn't actually released, a fart could actually hurt somebody where you're developing gas into the abdomen, stretch out so much that it causes a bowel obstruction or a bowel rupture, then that could lead to somebody getting super sick and they could potentially die. Let the farts out. Doc, this is the most embarrassing question of me. How do I stop peeing in my bed?
Did you wet the bed? I have to go.
There are a lot of factors relating to bedwetting, urinating in the middle of the night, and it could be as simple as drinking too much water before you're going to bed or medications that you might be on. But other things to consider are bladder stones, kidney stones that can cause somebody to have irritation of the bladder. The musculature of the bladder wall may be deficient. Constipation, incontinence, where the muscles aren't working as well and urine is just leaking out. More common in the elderly population and more common in women due to the fact that a woman has delivered a baby. It can stretch out the pelvic floor muscles. So there are multiple different things that could cause this. Make sure you're talking to either a urologist or a specialist about this. Good questions. If you guys have any concerns about your own healthcare, make sure that you go to see your physician, see your healthcare provider. Continue to send the questions in. We'll discuss them here on the YouTube channel in a generic form. And if you enjoyed this, definitely check out this playlist right here. Make sure you binge watch everything. And as always, make sure you subscribe, turn your bell notifications on, and hit that like button for me. Thank you so much for watching and stay healthy, my friends.